Whenever you administer a drug which is going to be a highly lipid soluble molecule, this molecule gains entry into the blood. Now from the blood, where it is going to be moving up at first, as you have already told, based on the blood flow, right? The organ which receives maximum blood flow is what? Brain, liver and kidney. The drug is distributed over there. But that drug is going to be highly lipid soluble and it is not going to be moving up. This drug is going to be having high tissue binding, so it is going to be binding up with the brain, liver and kidney. But as the drug concentration moves into the brain, liver and kidney, the concentration in the plasma tends to fall down. The equilibrium gets mismatched. So, in order to maintain the equilibrium, the drug from the brain, liver and kidney just tends to move into the blood to maintain the equilibrium. Now, the equilibrium is attained, but these drug molecules which is there in the blood cannot remain in blood because these are highly lipid soluble in nature. It cannot cross the equilibrium and move into the brain, liver and kidney. So, what it does, it moves into the next most higher blood flow receiving area, and what are those? Muscle. It just moves into the muscle and skin, right? As the concentration moves into the muscle and skin, majority of the drug as it is moving into the muscle and skin, the concentration in the plasma again tends to fall down. So, what will happen? Equilibrium tends to be mismatched. The drug from the brain, liver and kidney still more will move into the plasma to maintain the equilibrium. Again, this drug molecule cannot cross the equilibrium, so it moves into the muscles and tissue, muscles and skin. Again, the concentration in plasma fall down. Again, the drug molecule from the brain, liver and kidney will move into the blood to maintain the equilibrium. Which means, what we are seeing right now is what? We have administered the drug accumulates in the brain and it is moving into the plasma, into the muscle. From the brain, it moves into the plasma, into the muscle, into the plasma, into the muscle. This is what we explain it as redistribution. Here comes the most important question, guys. Among all these things, which is specifically called as redistribution? Is it the movement of drug molecule from the brain into the blood or movement of drug molecule from the blood into the muscle and tissue? Among these two, because in those two areas the drug is crossing biomembrane, right? Which is called as redistribution. Distribution means what? Movement of drug molecules from the blood into the tissues or organs, right? So, the movement of drug from the blood into the muscle and tissue, that property will be called as redistribution. Of course, the whole concept is called as redistribution, but that is specifically can be explained as redistribution, guys. So, if you want to put it up in a flow chart, here we can see the drug is going to be administered. After administration, the drug gets absorbed. It gets distributed to the brain, liver and kidney. It attains an equilibrium. But due to high volume of distribution and also high tissue binding capacity, the drug gets distributed to the muscles and skin. The plasma drug tends to distribute to the muscles and skin. Because of it, the plasma concentration tends to fall down. The drug moves from the brain, liver and kidney to the blood, to the muscles and skin. This concept is called as redistribution, for which drug tend to produce this beautiful response, and that is 𝗱𝗵𝗿𝗀, guys. 𝗱𝗱𝗵𝗿 sodium is a type of a barbiturate. Not only that, in certain conditions, even diazepam and nitrazepam also tend to produce this response. So, what is the primary mechanism of termination of action of 𝗱𝗵𝗿𝗀 sodium and its action, guys? 𝗱𝗵𝗿𝗀 sodium's action is going to be terminated by what? Before that, we need to know what exactly is 𝗱𝗵𝗿𝗀 sodium's action, right? 𝗱𝗵𝗿𝗀 sodium is a barbiturate. It behaves as a sedative hypnotic. So, before that, what exactly is 𝗱𝗵𝗿𝗀 sodium, right? 𝗱𝗵𝗿𝗀 sodium is a sedative hypnotic. Its primary action is in the brain, guys, right? So, this 𝗱𝗵𝗿𝗀 sodium needs to be accumulated in brain, but this redistribution is preventing it from accumulating in brain. Is that right? So, because majority of the drug is moving into the muscle and tissue, the drug from the brain is being removed out. The drug is prevented from getting accumulated in the brain, and that is also one of the reason. What is the reason for termination of action of 𝗱𝗵𝗿𝗀 sodium? It is both redistribution and metabolism. Is that clear? Now, we have one more concept called as selective distribution. What is the selective distribution, guys? Selective distribution means certain drugs tend to be distributed only to a particular area in the human body. Not only to the particular, majority will be accumulated in a particular area in the human body. Example, we have phenothiazines and chloroquine. Phenothiazines and chloroquine tend to bind with melanin containing tissue, especially in terms of retina. Phenothiazines are actually antipsychotic agents. Phenothiazines and chloroquine tend to produce retinal deformities. Visual disturbances can be expected with these different drugs. We will be talking more about that. When you talk about individual drugs, you will know, yeah, it is producing this response. Why? Because of this selective distribution.